Hello, Dr. Alicia Newsome here. So, this video is about the Dutch Plus and how you are going to collect and prepare to give us your samples. So, one thing that I love about this test is one of my favorite tests for looking at what's going on with your hormones. Extremely comprehensive and gives us a lot of good insight about what's going on inside of your body. And one of the main reasons is because it goes much further beyond what you would get from a normal blood sample collection. We are going to be collecting with your urine samples and then also your saliva samples. And I'll get into more detail about exactly how to do that. But first, what we want to do is talk about how to prepare for the test. So one thing is that you're going to want to fill out your requisition form front and back. You're going to want to mark what kind of test it is. So it's the Dutch Plus. And if you do an insomnia sample, so this sample is for if you are one that wakes up in the middle of the night, toss and turns, any of those different types of things, you'll want to go ahead and do that sample at nighttime so we can see what's going on with your hormones during the night. So you'll want to mark if you did the insomnia sample. And then you'll want to put in your demographic information. There's a space there for you to provide your address, your phone number, all of that information, your menstrual cycles. Are they regular, irregular? Do you not have them anymore? Have you had any ovaries removed? Date of your last menstrual cycle? And then there's an entire section here on the side that is color coordinated that matches up with exactly how you're going to collect your samples. So we'll get into that in just here shortly, but let's finish up this form here. So there's a section for hormones. So if you're on any hormones, you're going to want to list the hormone, the brand, the dose, all of that information. And then there's an important section down here at the bottom where you're going to just indicate if you're taking any of these specific supplements or medications, which is really important. There is another form within your kit, and this one right here talks about using hormones and the guidelines around this test. So this test is designed that if you are on any type of hormone replacement therapy, that you can test and see how that therapy is working or not working. So there's very specific guidelines around when to stop and when to take specific things, whether it's a cream, gel, suppository, patches, pellets, injections, or if it's an oral progesterone, or if you're taking DHEA, pregnenolone, any of those different types of things. There is one here, the glucocorticosteroids. That one you're going to want to let us know if you're doing any nasal sprays, if you're on any steroids, any of that information, because we may want to pause that depending on your situation for a period of time. It could be 7 days, 14 days, up to 28 days. It will just really depend on why you're on that and then how long you've been on it. Several different factors play a role, but we do definitely want to know about that. So let us know, and then we can guide you on that because that can significantly skew results. So very important there. So make sure you take a look at that if you're on any hormones or any of those steroids. Then on the back of this form, you are going to tell us about your symptoms and any disease state. So whether you suspect you have certain diseases or you've actually been diagnosed with them, you're going to talk about your fatigue, your morning, afternoon, and evening. You're going to rate those. And then there's a section here around your symptoms. So this one here, you're going to have 0 for like never have these symptoms, to 3 is like it always and they're severe. Now, when you see these, there's a section for women and there's a section for men. You're going to fill it out accordingly to your biological sex here. And what you're going to do is for instance, it has androgen excess here and it says loss of hair, scalp, increased body or facial hair, acne. And you might say, okay, well, I've got facial hair and some loss of scalp hair, but I don't have any acne or body hair. Just go ahead and circle which ones apply to you and then mark the severity of that, okay? And if they're the same, mark the same number, okay? If they're different, and I just want you to know this doesn't go into a computer or anything. When we do review this, it's manual. So we're able to just see exactly what you wrote on there. So if there's different things and they've got different ratings, feel free to circle and just write the number next to it, okay? I wish they would have separated those out so people could more clearly define the severity of what they're dealing with, but it is all kind of grouped together there. So just let us know. And then there's another section that just has additional symptoms, and then questions about your current weight, and then your hopes, and then also any additional medications or supplements that you're taking. So you'll want to fill this out completely, and you will just put that back into the box with everything when you go to ship it back. There is a section here on this other form that's talking about the instructions and FAQs where it says what to avoid. This is also right here when you first open up the box, okay? So very important. Foods that you're going to want to avoid, and you want to avoid these 48 hours beforehand. So avocados, bananas, and fava beans, okay? So they end up affecting some of the organic acid results. So you'll want to avoid those for 48 hours beforehand. And then there's some supplements that if you are taking them, you want to talk to us about those as well. So tyrosine, L-dopa, DL, phenylalanine, which is DLPA, mucuna, and then quercetin. So let us know if you are taking those, and you can also list them on the form as well. So very important for those. And then there are just some FAQs here. So if you're wondering if I missed the collection, if you're traveling, that's fine. One thing you want to do is once you take these, do the freezer or your saliva samples, you'll want to freeze these, okay? Your urine samples, you leave them out for about 24 hours before they dry. So if you're but if you're traveling and you're away, as long as it's a normal day, this is a good point here. So this entire test, you want to do it during the typical day, okay? So you don't want to do it while you got a big presentation at work, or you're having a surgery, or there's some type of stressful event going on and you had a heavy night of drinking and eating, any of those different types of things, okay? Now, if you're having a stressful day and stress is kind of like that's your norm, then yeah, that's your typical. It's okay to go ahead and collect on those days. So just be mindful of that. We really just want to get a typical day of your collection. And if you're traveling and that's kind of like how your life goes, I have plenty of clients that travel every single week, go ahead and collect, okay? And then the rest of the questions here are just about if you are a shift worker, hormones, and then urinating. Okay, so very important. So your urine sample, your first one that you take in the morning, let's say you normally get up at 6, but then sometimes you wake up at 5, you want to collect that first one, okay? We want concentrated urine throughout the sample. So even the day of, you're going to do your first 3 samples within the first hour of waking up, but after that, you really don't want to have more than 32 ounces of water throughout the entire day, okay? We want some good concentrated samples here. And if you drink too much water, then it's going to be diluted and it's not going to give us as much information as well, too. And then there's just a question here about children. So this test is designed for children 12 and up. And ideally, when I do this on children, they already have a menstrual cycle as well too. So just more important information here for you as far as there, but all of that's right there. And just a few things. When it comes to collecting your saliva, you are not going to want to floss that day. And you also are not going to brush your teeth at all prior to the first 3 collections. Now, mind you, the first 3 collections happen within the first hour of waking up. And so you're not going to have to go all day without brushing your teeth, okay? But the first 3 collections, there is no brushing your teeth there. So let's go ahead and move through exactly how and when to collect. And also no food, okay? So no food or drink an hour before your saliva samples. And that's because we don't want them to be contaminated, okay? And then, but you can rinse your mouth with water 10 minutes before, okay? So go ahead, swish around some water in your mouth because we do want it to be clean, but do that 10 minutes before you go ahead and collect. So let's go ahead and get started with how to collect your samples. So it's pretty nice the way that they have laid it out here, and it's been color coordinated. So you are going to have some samples that you do upon waking. So you're going to have 2 samples, which is your first sample, and you're going to do a urine sample, and then you are going to do a saliva sample. Do this within 5 minutes of waking up. You're going to pop this into your mouth you're going to open up the tube, and there's a little kind of cotton thing in there. You're going to pop it in your mouth, and you're just going to chew on it, gnaw on it. Not more than 5 minutes though, but you want to get it super, super saturated. And then once you're done, you're just going to put it back in here. So there's no need to spit into the tube or anything like that, but you really want to soak these very, very well. Okay. You're going to close it or pop it back into the small tube, put it into the big tube, make sure to put your name on it, the date, and the time that you collect it. You're going to pop these in the freezer until it's time to ship. Then you have your cards to collect. So what you can do with these is basically you can go ahead and urinate on the strip. You want to go ahead and urinate these two lines here between this area there, okay? So you're going to urinate on the strips directly, or you can use a cup that you can fill up with urine, and then you can dip it in there, okay? Once you have done that and collected the urine, you're going to put it just like this and let it dry, okay? And it's just going to dry for 24 hours, and then you're going to close it up and you're going to put it with the rest of them and be ready to ship. Make sure again to put your name, date, and the time that you collected on there, and then you'll do it here on the requisition form as well. So that is your first morning sample just as soon as you wake up. Then what you're going to do is you're going to do one sample of the saliva 30 minutes later. So it's good to set a timer throughout this day so that you know, okay, I've got to do these tests at a certain time. So the second sample is going to be done 30 minutes later, just your saliva. Go ahead, same thing, put it in your mouth, get it nice and saturated, pop it back into the tube. Make sure to put all the date and the time you collected on the tube, as well as your requisition form. And then your next sample is going to be just saliva as well. So you are going to do your saliva sample, and what you are going to do, same thing. This one is another 30 minutes later, okay? So it says on the tube 60 minutes after waking, okay? Or 60-minute sample. And on the requisition form, it says 60 minutes after waking, okay? So you're gonna do, these are your first 3 samples. No brushing your teeth, no flossing, none of that before these samples. After you do that one, go ahead and brush, get those teeth nice and clean, okay? And then you're going to move on to sample 4. So sample 4, you are going to go ahead and you're just going to do urine. So with the urine, same thing, you're going to go ahead and collect some urine, and you're going to do this collection time 2 to 3 hours after waking. So think about this. You have done a sample right when you woke up, a urine and a saliva. 30 minutes later, you did a saliva. Another 30 minutes later, you did another saliva. And then this one, so imagine you've been up for an hour now. This one's collected 2 to 3 hours after you've been woken up. So this is another hour later, okay? So this was an hour after waking. This is 2 to 3 hours after waking. You're going to go ahead and collect your urine. And then you're going to move on to your evening samples. And with those, you are doing them between 4 and 5 p.m. Okay, so you're going to do a saliva and a urine, and all of this is just mapped out for you right here. Okay, so you can literally keep this little, kind of use it as a checklist next to you throughout the day as you're collecting these samples. And you're almost done. So you're going to do those between 4 and 5 p.m. And then you're going to do your last sample between 10 p.m. and midnight, okay? And everything's labeled for you, okay? And it's all color coordinated, and it matches what's right here on the sheet, okay? So you're going to do a urine and you're going to do a saliva, and then that's it. Unless you wake up in the middle of the night, you can go ahead and collect a insomnia sample here, an overnight sample, if you do wake up, and that one's just saliva. So that is it for the Dutch test. Now let's talk about when to collect for your Dutch Plus, okay? Very, very important. So typically this test is used, or I like to use it for women that no longer have a menstrual cycle, whether that is due to having a full hysterectomy, meaning that your ovaries and your uterus were removed. You've entered menopause, which means that you've gone 12 months with no menstrual cycle or more. And those are usually the two that I'll have do this. If you still have your ovaries, but your uterus has been removed, then I typically have you do cycle mapping plus, because that lets us know, because the ovaries may still be at work, and exactly what they're doing through the month and how that's affecting you. If you have irregular cycles, then I like to do the cycle mapping plus as well, because that lets us know estrogen is supposed to go up at the beginning of the month and then come back down, and then progesterone goes up that second half of the month and comes right back down too. So it lets us know exactly what's going on throughout the month, because your hormones are changing throughout the month. It gives us that information. Sometimes I will use this test if a woman has very regular cycles and it's very simple to determine when she should collect. So if you are cycling and we've decided to use this test, then basically you want to collect during your mid-luteal phase, which means that from the time you ovulate until the time you bleed again, you have your menstrual cycle, that halfway point in there, okay? And for a 28-day cycle, you'll want to collect between days 19 and 22, right in that middle time there, okay? If it's a little longer, you just add 1 day per cycle. But when it starts getting a little crazy, I just like to use this test because it gives us all the good information about exactly what's going on with your hormones, okay? So I won't go too deep into that. But the main part is, if you're not cycling, for whatever reason that may be, then you just pick a day and you want to make sure that it is a day that is the most typical for you, okay? Nothing crazy or different happening on that day. And then just follow the instructions as far as food and drinking, all of that while you're collecting throughout the day. So I hope that this was very helpful. Let us know if you have any questions. Reach out to your coach and they can help walk you through if you have any questions at all with this too. I love how Dutch really just color coordinated everything on this form here for you and just matches everything up.